ferritin. Now, when you hear ferritin, you need to already be thinking iron, right? Fe, remember from chemistry, iron. So ferritin has to do with iron. Let's talk about it in just a second here. For adult men, you're looking at 20 to 250. And for adult women, you're looking at 10 to 120. And adult women older than 40, you're looking at about 10 to 260. Okay, so the level is going to be different for men and women. It's going to be different for women as they age as well. So like we said, ferritin has to do with iron. Okay, so what is ferritin? All right, ferritin is a protein found inside cells of basically almost every living organism, okay, including algae, bacteria, and many kinds of animals. So, and what ferritin does is it's found inside the cells and it stores iron so that our body can use it later. Okay, so it's important that we have iron. We'll talk about iron in a little bit, but we know that we need this iron. Okay, so what ferritin does, it actually stores this iron within the cell and then it releases it for our body to use later in a very controlled manner. Okay, so levels will vary according to age and gender, but the levels are not necessarily affected by how much iron we intake, okay? And they're not really subject to how much we get rid of. Now, one of the reasons that we're going to run a ferritin level is because as compared to total iron or total binding iron capacity or TIBC, ferritin is much more sensitive to iron-deficiency anemia. Okay, so if we really want to determine what kind of anemia our patient has. Let's say we find out they have anemia, but we want to find out, what kind. Is it pernicious anemia or iron deficiency anemia? What kind of anemia is our patient experiencing? We're going to run our ferritin level. And this will really give us a really good idea. If the level's less than about 10, we're going to start thinking that our patient has iron deficiency anemia. So it can be used really specifically for that, for diagnosing iron deficiency anemia. And it can also be really helpful during pregnancy, and it can help us kind of monitor hematologic responses and how the woman is doing during pregnancy, so we can run ferritin at those moments. Another reason we'll run ferritin is it can help and it can support a diagnosis of iron metabolism and storage disorders. Okay, so some of the reasons we're going to see a decrease, like we already talked about, is going to be like iron deficiency anemia and then hemodialysis. Some of the reasons we'll see it elevated would be like iron metabolism disorders, okay? We might also see it elevated with fasting, with alcoholism. You can see it elevated with an acute or a chronic infection. And then we'll also be elevated with leukemias. So you can think some of these blood disorders as well, and thalassemia as well, it's going to be elevated. But really what you need to remember here and what I want you to think about is that one of the main reasons we're running this is to identify iron deficiency anemia. It's very specific to iron deficiency anemia. And so if we have a level lower than 10, we're really thinking we're thinking iron deficiency anemia, okay? And just remember, ferritin stores iron within the cell and it releases it as it needs to in a very controlled fashion.
Thank you for listening to our podcast today. Nursing.com is the trusted learning hub of all future nurses, your secret weapon for passing nursing school with your sanity intact. We want to invite all our listeners to visit us online and take advantage of a special promo offer. Just head over to nursing.com/free. That's nursing.com/FREE. And check out the free resources and other goodies that we have there, just for our podcast listeners. Until next time, go out and be your best self today. And as always, happy nursing.